I have had an amazing experience talking to some amazing people about clinical research. Clinical research is a part of all of our lives. Let's talk about it. To tell us a little bit about what you do and your perspective with regards to clinical research and health and other things. So please tell me what helped you to say, I think I should stop by there and talk to them.
No, I was just very curious. I'm a certified birth doula in New York City. And what I've noticed is that for many of my Black and Brown families, they're facing clinical testing to
Mhm.
help evaluate and see what's happening with their pregnancies. But
Yeah.
oftentimes their results are not, they're coming back inconclusive, or they have to redo the
Mm.
test because I really don't think that the test really has their genomes or their chromosomes or their ethnic, whatever it is. They just don't have the diversity. So my Black and
Wow.
Brown families are going for more testing, retesting,
Hmm.
inconclusive testing.
Oh, how scary.
Very much so. So I think
Yeah.
that the medical base of this country, it was not intended for people of color.
Oh, wow. Now, that's a loaded statement. I can't tell you that I disagree with it because we have seen so much of that. And that's part of the mission of Care Access to diversify clinical trials and clinical research so that the stuff that we don't know, as far as safety and efficacy,
Right.
then we can tap into it and try to figure out, okay, so what don't we know and how can we correct some of the
That's
things
right.
that haven't been talked about before. So
Hmm.
there's an educational component to it as
I
well.
agree.
So I'm also wondering if, in addition to it being scary for your Black and Brown families, is there a cost component because they have to be retested or?
Oh, there's insurance approvals and there's
Mhm.
increased deductibles and copays. So yes, economically, it does pose a challenge to our Black and Brown families.
Another barrier?
Another
Ah.
barrier on top of, not being able to fully explain the test. The health literacy component is really not clear enough. And
Yeah.
it really puts in a lot of barriers, and it really puts up these walls of fear and
Hmm.
intimidation for my
Hmm.
Black and Brown families to really try to navigate through to have a successful birth outcome. That's all they want. They just
Right.
want to have a successful birth outcome, but the health literacy is really not equal, and it's not accessible
And not equitable.
and not equitable.
Yes. So here we are with this DEI component, diversity,
Yeah,
equity, inclusion,
right.
and we're actually putting up barriers that are in addition to things that were already there that have become a part of the fabric of healthcare.
Sure is.
And now we have an opportunity to do something about it. What would you suggest is one of the very first starting points to start breaking down some of those barriers?
Health literacy. Our Black and Brown families do not trust the medical system
Mhm.
because of the institutionalized racism and experimentation done on Black and Brown bodies to build the medical community in this country. So
Mhm.
our families don't trust. So
Mhm.
you have to go into communities and give them health literacy and let them understand that if they participate, then they can represent and they can have a change in the test outcomes and have a better access and hopefully have a better understanding, and they can participate better in their own healthcare.
Oh, I love that. So that you have like put in a nice precious package what Care Access is attempting to do with our mission. But I
Nice.
want to lean in a little bit on the health literacy. So
Sure.
that is taking some big words, and it just really means that we need to help people to understand and to know. There are different approaches that could be used to help people to understand and to know, but there's the time aspect. So, if you were to speak to how long that journey is between someone beginning to trust, and especially in a pregnancy situation, which is time based,
Yes.
what would you advise with regards to that, with increasing health literacy for something so precious as bringing a life into the world? Health.
It has to start in preconception health. We
Mm.
have to have these conversations in junior high schools. We have to get people to understand that having an annual physical is not punitive.
Right.
And we also have to understand that the maintenance of our bodies is all of these things that Care Access is trying to do, is
Yeah.
to help us better understand our bodies, right? So if you do this, then you'll have a better understanding. The health literacy will come, the trust will come because now you're better represented, and
Yes.
now you'll feel more comfortable going to your doctor who's not treating you off of an algorithm.
Right.
They're treating you off of facts that they actually were able to get. So I think it's a win-win, but it's going to take a little bit more time to get this going, especially with COVID and vaccines and things. But there's a big mistrust in the Black and Brown community when it comes to health sciences and healthcare.
I love that you also spoke about preventative care as well.
Oh yeah, I'm a big fan of that.
Good.
Big fan of that. I've seen in my own Black family
Mhm.
what not doing preventative maintenance on your body and your health will do.
Mhm.
It's not a win.
Right.
It's not a win.
Proactive over reactive.
Overreactive, or
Yeah.
better yet, I wish I coulda, shoulda, coulda, woulda kind of thing. It's
Yeah.
too late.
Right.
You're now in a comorbidity that you can't get out of, and that now is going to decrease your quality of life and
Mhm.
your lifespan.
Yes. And there are clinical trials for those who have, comorbidities as well. And we're here for that. But at the same time, if we can tap into it earlier on, and then
Right.
we can actually put some therapies on the market that are inclusive, that are diversified, then it'd be interesting to see how those babies are born, wouldn't you think?
It sure would be. But
Yeah.
once again, it's all about the trust and it's all about the health literacy in that community. How health literate is that community?
Mhm.
Because if they are, they're going to be more willing to be receptive and at least give it a chance.
Right. So we need partners. We are so huge on partners. Yes, we need the sponsors that will sponsor the studies, but we also need people like you who say,
Oh.
okay, well, we trust you. So who is this clinical research or care access people? Tell us about them. What does that look like to you with regards to, okay, so I'm bringing this outside entity in. They want to come in and for the betterment of the community,
Right.
for others who have babies 10 years
Mhm,
from now.
mhm.
What would you say to them? What would you say to your moms, your families?
It's time to change the generational pattern that we have, and you want to do this to extend your life to see and be a grandma, be grandparents. You want to enjoy your family legacy, which is really important. But, also too, the community can also support this. Sororities, fraternities, churches,
Yes.
synagogues, all those type of communities could really come in and step up and help out with this because those are trusted entities.
Yes. Yes. So bigger than you?
Much bigger than me.
Really?
Yep, much bigger than me. I mean, doulas change the world. I know it. Doulas change the world, but it's great to have those other really fortifying entities in the community, like fraternities, sororities, churches, synagogues, um, organizations. The Lions Club, all those,
Yes.
the links. There's
Links.
so many
Mhm.
great things that could really turn out and have great turnouts for things like this.
Oh, I love it. I love it. I put exclamation points behind every one of your statements and I said it's time. It's time to take you and all that you do and other doulas and you can influence so much to where someone says, "You know what? She made such an impact on me
Oh,
and she
thank
brought in
you.
this care access clinical research people. They were good people. She's good people. The trust level has increased. Maybe I want to take the step to be a part of this momentum that's happening."
Well, okay then. So come on, Care Access. Let's go to Black Mothers Matter conference. Let's go to A1. Let's start hitting some of these
Mm.
conferences where my people are, our people are,
Yeah.
and let's do it. Sure.
I love it. Oh my goodness. Denise, you are amazing. You are
Thank
wonderful. You
you.
already knew that.
This was
We
fun.
just get a chance to tell you on camera. But yeah.
I had a great time. Thank you.
Thank you so much. Thank you for all you do. And can we take a picture with you?
Of course.
Okay.